screen?
Yes, ma'am, it's
Wonderful.
clear.
Excellent. Well, I'm pleased to present to you today information that I have on bone trauma and gunshot injury and poisoning in wildlife forensic pathology. I work at the National Fish and Wildlife Forensics Lab, which is part of the U.S. federal government system within the Department of the Interior. This lab has been here for almost 30 years, and we receive wildlife from all over the 50 states and the U.S. territories that are considered dead things that are considered to have some human hand in their death, so some crime associated. We generally don't deal with disease. We have a sister lab in Wisconsin that does that, so we are only forensics focused. So I need to first start off by saying that the information I'm going to present, it is not part of the policies or the opinions of the federal government, but is part of my own experience. But today I'll be going over bones, their structure and function to start off with, just as a review, because we need to remember and be reminded of how bones function and how they are built in order to understand how they fracture and how they fail. And I'll go over a few little cases on bony fractures and the traumas that caused those. Then I'll segue into gunshot wounds, go over a little bit of the types of firearms that are used in the US, and then talk about determination of trajectory and determination of the type of firearm that was used and the way you can build a case around a firearm incident. Then if we have time, I'll talk about some of the poisoning cases that we see, the poisons that are most commonly used in the US. So I'll start off with bone fracture and gunshot. Okay. So, of course, the foundational structure of any body, human body, animal body, is the skeleton. The skeleton has attachments to it, and it contains everything that allows us to move, that allows us to breathe, that allows us to exist. These varied forces that are placed on the bones by muscles and by the internal organs dictate what they're shaped like. So the flat bones like the scapula, the skull, those are more for containment and for broad attachment, whereas the long bones of the limbs are more for weight bearing. And these weight-bearing bones, the long bones, are formed of osteons, which are longitudinally arranged along the shaft of the bone that provide a structural strength to the bone that allows that bone to be compressed. This is very much like pylons of a bridge. So the pylon of a bridge is mostly made of concrete, but it has these long longitudinal iron bars. This allows maximum strength to also balance with lightweightness. If we wanted to be super strong, our bones would be completely solid and we wouldn't really be able to get up off the chair. So we need to have super strength along with a balance of lightweightness in order to structurally function. So this osteon system allows our bones to be compressed. They are really okay with weight bearing, but they're less okay with being distracted. When a bone is pulled apart or when joints are pulled apart, the bones tend to fail more readily than if they were being compressed. Within the ends of the long bones are trabecular structures. In this trabecular structure, the fine triangulation, the fine cylindrical bone or spongy bone is also present between the lamellae of flat bones of the skull and the scapula. The trabecular structure looks fine and randomly arranged, but those trabeculae are actually arranged at points where that bone needs the most strength. So at points where that flat bone is being compressed, those trabeculae form to shore up and make that flat bone stronger. So I'll start with talking about bony fractures, and for simplicity's sake, I'll stick with the fractures of the shaft of the long bones. And the most common fractures that we see are transverse, obliques, spirals, and comminuted. And the type of the fracture, if you are presented with an animal with a fracture, the type of the fracture can give you an indication of the force that was impacting that bone to cause that fracture. So the reason we're going to go over the fractures first is, and then we can work backwards to figure out what may have happened to that bone and build the story around that animal's death. So bones follow Newtonian physics very well. You know, we all went into veterinary medicine to not do mathematics, but really Newtonian physics and mathematics does apply to forensics and does apply to pathology. So a bone at rest is going to stay at rest. The force applied to a bone is equal to the mass of that force as well as its acceleration, whether that's speeding up or slowing down, abrupt stop. And also, a force applied to a bone is going to have an equal and opposite impact on that bone. So a big force applied, it's going to have a big impact. You're going to see a big fracture in that bone. So we'll start off with the transverse fracture, the most simple fracture that we have. On the right hand of the screen is my little graphical representation of a bone. And the boxing glove represents the force that's being applied to that bone. Transverse fractures occur when a force is applied at 90 degrees perpendicular to the long axis of the bone. And it just causes a very simple straight across break. This type of perpendicular impact can also cause what's called a butterfly fracture. So remember that bones do not like to be distracted or pulled apart. They're okay with being compressed. So when a force impacts a bone, the opposite side of that impact is being bent, is being pulled apart. The opposite cortex is being pulled apart. And that opposite cortex will fail first and will fracture first. And in a butterfly fracture, the fracture splits into two and then goes towards the force of the bone, causing what some people refer to as a butterfly fracture. And that's because the distracted bone will fail first, whereas the compressed bone holds out until those fractures move around to the other side of the bone. An oblique fracture occurs when there is a compression force on the bone. The bone is under load, it's being stood on. Something is compressing that bone, and a force from the side comes at it at either a perpendicular angle or at a slight angle. And in this case, this will cause a shallow oblique fracture, one where the angle of the fracture is not quite so acute. If that force is compressed and there's an angular impact to the side of the bone, plus a bit of a twisting force on the bone, that oblique fracture can turn into a longer oblique fracture, and the fracture line will be longer up the shaft of the bone, and that fracture angle will be much more acute. A spiral fracture occurs when one end of the bone is fixed. So a foot in a hole, something that is just making that one end of the bone not be able to move. And then a rotational force is placed on the other end of the bone. And so this results in what is kind of like an oblique fracture, but the fracture line goes down and then has a step where the two ends of that spiraling fracture line meet. We often see this artifactually elicited when dead animals are desiccated. Their joints are fixed in position and they're shoved into a cooler. The wings sometimes get rotated and we get an artifactually induced spiral fracture. But in real life, this might occur due to running away when they get a foot stuck in a hole and then twist to try to get out of it. You'll get that spiral fracture. Looking end on the bones, the oblique fracture and the spiral fracture look slightly different. The oblique fracture, if you look end on, will be oval shaped on both ends of the bone, but the spiral fracture will have points. It'll be sharper. Now recall back to the Newtonian physics, and a comminuted fracture, which is a highly fragmented fracture of the bone, is often a result of a big force. So the force equals the mass. In this case, our mass is big times acceleration. And if acceleration remains the same in this case, a big force, a big mass will cause a highly comminuted fracture and high fragmentation of the bone. Bones may also be perforated with holes punched in them if a really high force is very, very small, as in a bullet or a tooth. A long bone sometimes can be perforated, especially where the cortex is pretty thin, like up at the ends of the bones. Generally not in the shaft where the cortex is thicker. But most often, bony perforation can be found in the flat bones. Occasionally, ribs and other long-ish bones can have chip fractures through the side of them, bones that don't have quite so thick a cortex. So now that we know how bones can be broken, we can then work backwards to figure out what forces there were to cause that specific bone fracture. And when dealing with and analyzing and doing a postmortem on fractured animals, you also want to take into account where the bones were fractured on. Is it all on one side of the body? Is it on both sides of the body? Are there more than one bone that is fractured? And then you also want to take into consideration the scene where the animal was found. If you can go there and see firsthand, or you can talk to the law enforcement officer that was there and get an idea of what site the animal was found in, if there are other things around, if it's a road, if it's in the middle of nowhere. What scenes can give you a clue that will help you build the story around the animal's death. And then also you want to take into account the type of soft tissue injury that may be there as well that can help to build that story. So I'll start with blunt force injury. This is actually a window in the lab in one of our hallways, and this is an outline of a nice pigeon that happened to fly in, thinking it was not a window. Pigeon lived and flew away, but this was just a good intro to blunt force injury image. Blunt force injury can cause any different kinds of fractures in bones. It is kind of a generalist when it comes to creating injury on bone. So as a case report, I'll share this bald eagle that was found on a long stretch of road. So we're taking into account our scene considerations. This is a Google image of right around where the animal was found. There's power lines, there's crops, there's a residential area. So you want to take into consideration everything that's there, but you don't want to narrow in on any one thing. In this case, electrocution is a consideration. There's crops, so there might be some kind of toxins being laid out. There's a residential area, so it could be gunshot. It's a road, so there could be a hit by car. There's nothing in this scene that can really narrow you down, but you should consider what's there. So in this case, what the X-ray of the eagle was largely unremarkable, except for this very small transverse fracture of the right tibiotarsus, and that was the only bony issue that was there. Grossly, on internal examination, the bird also had lacerations of the lungs and liver, which we heard from the previous speaker are highlights of blunt force trauma. So this was a hit by car. Similarly, this golden eagle also found on a long stretch of highway, near power lines, residential areas. There's crop land over here, so kind of a similar condition we're talking about. But in this case, The golden eagle had some highly comminuted fractures of the right femur, right tibiotarsus, and the internal organs were described as pulpified, which is just highly lacerated and rather destroyed. So in this case, there was a high-speed collision with a car. We're assuming the cars are going to be the same mass. So this was a higher speed collision with a car, higher than the golden eagle of the previous case report, resulting in more severe trauma to the bones and soft tissues. Our third case is the case of a gray wolf that was found kind of in the middle of nowhere, but on a long stretch of road. No power lines, probably not electrocuted. It's also a gray wolf. So, and there were just trees around, no cropland, but there's a little residential area right in there. So we're narrowing our focus based on our scene considerations. And in this case, radiographs showed that there were several rib fractures along the right side of the body. And this is a very common finding in hit by cars. Cars will impact on one side of the body usually, causing rib fractures on that side. It is very unusual because of the cushioning of the internal organs and the flexibility of the ribs for the ribs on the other side of the body to be fractured. Generally, they're just on the side of impact. But there was also a fracture of the antebrachium. There was a transverse fracture of the ulna and an oblique fracture of the radius. So if it got impacted on the right side of the body, why is the left leg broken? Well, likely this animal was standing on the left leg, so it was weight bearing on the left leg. The right leg was just pushed out of the way by the car bumper. But because that impact, that leg was compressed and impacted on the medial side of the leg, there was fractures of that particular leg. So the radius is the weight-bearing bone in the forelimb. And because it was weight-bearing, remember, under compression and an impact from the side can cause an oblique fracture. So the radius was weight-bearing, impacted from the side, and caused an oblique fracture. The ulna, not quite so weight-bearing as the radius, but was impacted from the side and resulted in a transverse fracture. Now there it was a really good paper put out about 4 or 5 years ago from some ornithologists that reviewed mortalities of birds flying into wires and compared them to birds that are electrocuted. They took this literature review and then extrapolated it to all the wires and all the power lines that were in the United States. And they hypothesized that between 8 and 57 million birds die from flying into wires, from collisions with wires, whereas about 1 to 11 million birds die from electrocution. Now that's about 1 electrocution for every 5 collisions with wires. Now, like I said, we have almost 30 years of data on birds that have been submitted, and over that time we've had 6 veterinary medical examiners taking a look at these birds. We've seen about 12,000 bird cases come through, and of those 12,000 birds, we've had exactly 31 that we have seen that have flown into wires. During that time, we've seen almost 700 electrocutions. So compare our data, which is about 1 electrocution per wire collision, for 1 electrocution per 28 1 electrocution per 28 wire collisions. It doesn't pass the examination test. Our data did not agree with the data from the ornithologists. So I decided to do a simulation to determine what kind of injuries can be incurred by a bird flying into a wire. And we took dead owls that had died at a rehabber, and we set them up in this long stretch of road. This was our experimental area. We set them up in a position that they would be flying, and then we struck them with a rod, approximately the diameter of a wire, that was going at approximately the speed that the bird would be flying, so about 35 to 45 miles an hour. So this was our setup. We had the owls, the dead owls, dangling in flying position, and then we had strapped a bar on the back of a vehicle and struck the bird with the bar. Like that. So impact occurred on the leading edge of the wing, and we did both wings for 3 birds. What we found, what we elicited on the right wing, was this very nice butterfly fracture. So thinking back to how the butterfly fractures are made, the impact was on the leading edge of the wing. The opposite cortex was being bent and pulled apart, and it failed first and caused the nice little butterfly fractures on either side of the impact zone. So that is the way that looked grossly. I did mention to take into consideration the scene, and in some stretches of road that have power lines, etc., there's a lot that you have to take in, but for wind turbine farms, the scene is pretty well honed. There's not much that happens on a wind turbine farm except birds getting hit by wind turbines. So in this case, a golden eagle was found under a wind turbine, and if you look very closely, there is a bit of asymmetry in where the ribs attach to the spine. And sure enough, there was detachment of the ribs on one side of the body. So again, blunt force impact tends to fracture ribs unilaterally. Had another golden eagle wind turbine case. And in this case, there was a comminuted fracture of the ulna. Now, this comminuted fracture looks a lot like several transverse fractures because wind turbine blades are huge. They can be 107 meters long. They can be 2 feet wide at the point of impact close to the hub or the nacelle. And at those points where they're 2 feet wide, they can be going 55 miles an hour. So it's like being hit with the broadside of a filing cabinet. At the tips, where they are narrower, the blades can be going about 180 miles an hour. So it is a very high speed impact. And it is not uncommon for us to see wind turbine cases that come to us in pieces. This particular golden eagle came to us as a wing separated from the trunk, and the left wing separated from the legs. So it's a high speed, high energy impact, and it can break a bird apart and cause comminuted fractures of the whole body. Are there any questions so far before I head into gunshot wounds?
You can go ahead, you can have it at the end. Yeah.
Okay, great. So I'll segue into gunshot wounds now. Gunshot wounds, while a car can go 55 miles an hour, a wind turbine blade tip can go 180 miles an hour, a bullet can be traveling at 1,200 miles an hour. So the impact on the bone is very high energy, high force. Generally, you'll either get a perforation of that bone or you'll get comminuted fractures. Bullets and shotgun shells and things like that generally are going too fast to be able to cause just a simple transverse or oblique fracture. Perforations most often occur in the flat bones, like of the skull or the scapula, and the way the bone fractures can indicate which way that bullet was traveling. So that the side of the cortex that is directly impacted by the bullet, i.e. this convex side, where the bullet impacts, the bone just disintegrates. It just disappears. As the bone passes through that bilamellar structure of the skull, it pulls the cortex on the inner or the concave aspect of the skull away with it. So you'll get this beveling look. So it's clean, a clean hole on the outside of the bone where the bullet first impacts, and a bevel on the inside to indicate direction of travel. So this is kind of my schematic on how that happens. So this clean hole on one side and beveling on the other. Case report to describe this is another wolf that was found in the middle of nowhere. All we got was the skull, and because the skull is wolf-like, we were sent it because it was suspicious for human activity. This turned out to be just a dog, but we did find a hole in the middle of the skull. It was very clean and very concise bullet hole that was just in the temporal bone of the skull. A similar case, similar area of the skull, is very clean edged on the outside with beveling on the inside. And taking a little closer look at that, this is the outside of the skull. There's even some gunpowder residue at the edge. And then the inner surface of the skull, there's beveling where that cortex was peeled away as the bullet went through the skull. In some instances where the bullet goes through a flat bone at an angle, as opposed to at a right angle, but at a more acute angle, you can get a keyhole fracture. So where the bullet goes through, you get that nice punched out, clean edged hole. But as the bullet passes at an angle underneath the other side of the bone, the cortex is pulled away. So as a schematic, you get destruction of the bone where the bullet impacts directly, but pulling away of the cortex where the bullet passes indirectly. So you get features of both entry and exit, and having this, you can tell that a bullet went through that flat bone at an angle. So when you're building the case around a gunshot wound, you want to see if you can figure out the type of weapon used. Usually it's easy to tell if it's a high velocity weapon like a rifle or a shotgun, because the ballistic elements are different. You want to just see if you can tell trajectory, because this is important if the suspect is claiming self-defense. The wolf attacked it, the bear attacked it, I had to shoot it in order to defend myself. But if the trajectory is from back to front, that does not support the suspect's claim. You also want to determine how many projectiles are involved, how many times the animal was shot, and then what effect that shooting had on the animal. If the bullets went through the muscle of the back leg, probably not too much of an impact. But if the bullet went through the heart, that would be more immediately fatal. And then you also want to determine if the bullets have been there a while. Is it an acute injury, or has it been around and has the tissue healed over? The firearms that we generally see are rifles, shotguns, and handguns. If I ever see a submachine gun or a machine gun injury, I'll run away. So what I'm going to talk about are just the first three. And just like bone fractures require Newtonian physics to understand them, you have to understand kinetic energy to know how ballistics can have an effect on the body. So, like I said, the bullet is going 1,200 miles an hour. It has a lot of energy in that speed, just in that speed itself. And when it impacts a body, it will slow down remarkably, and it will lose that energy at a perpendicular around its wound path. So it will transfer that energy, that kinetic energy, into the tissues surrounding it. So the higher the speed of the bullet, so like rifle bullets, the more damage is induced in the surrounding tissues. To illustrate that, this is a picture of a bullet going through a ballistic gel. So as the bullet goes through, it causes expansion of the energy around it as it slows down and hits tissues. There is tearing, there is expansion pushing away of those tissues that then collapse in on themselves, but there is then a permanent hole or a permanent tract that is left behind after the bullet. This is a video of a bullet going through a ballistic gel, and you can see as it goes through, it causes this large temporary cavity as that initial kinetic energy is transferred, that then collapses and forms a more permanent cavity after the bullet leaves. As the bullet goes through, material can be pushed out both ends of the hole. So the bullet is pushed out one end, but the kinetic energy and the collapse of that tissue can then squeeze material out the back end of the hole where the bullet first came in. Okay. So rifles are the most common hunting implement in the United States. They are long-barreled and they're designed to be shot from the shoulder. They're called rifles because of the lands and grooves that are cut into the barrel of the rifle. These lands and grooves have a twist to them, and that's supposed to impart a twist on the bullet that makes it fly straighter and truer and more accurately. This is a barrel with those lands and grooves cut away so that you can see them. And these lands and grooves then impart striations on the bullet itself that when examined by a ballistics expert that bullet can be linked to a specific firearm. So if you get a bullet from an animal, you can link it back to a specific firearm from a suspect. Most of the firearms that we have are centerfire rifles, meaning that the gunpowder is in the very center of the bottom of the bullet casing, and a pin is then struck on that gunpowder, which then propels the bullet out of the firearm. These are high velocity weapons, so the fastest going bullets, and the bullets themselves are designed to break apart often so that they do the most damage to an animal and cause a quicker kill. Hunters don't want an animal to be injured. They want it to go down quickly so that they can retrieve it. The bullets often have a lead core, which is a very friable metal and will break apart more easily, and a jacket, usually of copper, that keeps it all together. Most often there's a hole or a plastic piece at the top that allows that bullet to open up and to fragment to cause the damage to the tissues. And this plastic tip is often used by manufacturers to indicate visually what caliber or what manufacturer that bullet comes from. The plastic tips can be found in the wound tracts often. They're not radio dense. Over on x-rays, they look like soft tissue, so you have to visualize them. But if you do see them and you don't get any bullet fragments large enough for analysis, those plastic tips can at least help you come down on a manufacturer or a type of rifle. Shotguns are also long-barreled firearms that are designed to be fired from the shoulder. They have a smooth bore. They don't have that rifling pattern that the rifles have. And the ballistics that come out of them are going at a slower speed, so they don't go as far, and when they impact an animal, they're not going as fast. Most of the shotgun cartridges are filled with gunpowder with a wad over top, and then varying sizes of metal spheres that are usually lead but can be steel or copper. The spheres range in size depending on what the target is that the hunter is going for. So smaller spheres between 2 and 5 millimeters are for birds, and for larger game like deer, the spheres can be up to 9 or 10 millimeters in diameter. For very large game, like deer size or larger, often shotgun slugs will be used. And in place of those spheres, those shotgun pellets, there's just a large solid lead slug. And this impact is designed to bring down larger game. As the shotgun shell is fired out of the shotgun, the spheres, the metal pellets, stay in a cluster. But the further away they go, the more they spread out and the more they slow down. So if you shoot something from a close range with a shotgun, you're likely to get a fairly decent sized wound and the pellets will go deeper into the tissues. Whereas if you shoot from a distance, maybe a handful of pellets will reach the animal and they'll only be embedded superficially. So in this case, this was a grackle that was shot on the right side of the body with a shotgun. And there are several entry wounds. And you can tell they're entry wounds because feathers are protruding into the wounds, into the pectoral musculature. And don't forget to look at the feathers. This is a condor that was shot, and there are little divots taken out of the feather barbs that when the wing is folded to the side of the body, those holes in the wing line up. So you can tell when a bird is shot, if it was at rest or if it was in flight based on whether the holes in the feather barbs line up. Additionally, one of the feather shafts had a little divot taken out of it by the bullet. And feather shafts can be taken and examined under X-ray fluorescence, an XRF machine that can detect small, tiny microscopic traces of lead and copper and other elements that you can't either see or you can't see on a regular X-ray machine. And if the gunshot question is equivocal, if you're not sure if you're looking at gunshot wound, testing these feather shafts to see if there's traces of lead and copper can help build your story. So in this case, we had a juvenile golden eagle that was found dead under a power line. Again, it was found dead under a power line, which is good information, but don't hang your hat on just that. In this case, we had 3 types of ballistic elements involved in the body. There was this lead snowstorm around the neck and shoulders that was from a rifle bullet breaking apart like it's supposed to when it impacts tissue. There was a metal sphere within the coelomic cavity and also a larger deformed metal chunk at the leg. On necropsy, we pulled out of the ventriculus contents this metal sphere. And then we found this larger metal bullet fragment embedded right there in the soft tissues of the leg. There was no overlying wound tract. There was no hemorrhage. The soft tissues were healed around it. In fact, it was pretty hard to get it out. So this wound had been there for a significant period of time, weeks, months, years, prior to the death of the animal. But that lead snowstorm of bullet fragments was associated with extensive hemorrhage, laceration, and fracture of the shoulder apparatus. So this was definitely the fatal wound. The fragments, if you can get them, if you can retrieve them, a ballistic analyst can look at them and at least determine the type of metal that is involved and potentially look for striations that can link that bullet to a specific firearm. But in this case, the fragments were too small for retrieval and there was no ballistic tip that could be found. This deformed bullet fragment in the leg did turn out to be lead, but was so embedded and so chronically there that it was causing no problems whatsoever in this bird. The lead does not leach into the system if it's embedded and fibrosed in, and there was no damage to to the soft tissues or the bone in association with that bullet. The pellet that we found in the stomach contents turned out to be non-toxic. I believe it was copper, so also not causing a problem to the health of the bird. The bird probably ate the pellet with some other prey species that happened to have it in it. We rarely see air rifles and air guns as a cause of death. Air rifles and air guns are generally used for shooting practice or to chase away nuisance wildlife. So it's not usually a cause for the death of the bird or the mammal. But we do see embedded pellets, like the pellet or the bullet fragment that was in the leg of the eagle. We do see embedded air gun pellets within the soft tissues of a lot of birds. And they generally don't cause any clinical issue. For example, this is the neck of a Canada goose. So that's his ear. That's the hyoid apparatus. This is the back of the neck. And embedded here on the side of the neck is an air gun pellet. And it's just surrounded by fat, fibrosis, no hemorrhage, no overlying wound tract. It was just shot at some point in time, and it healed over, and it was doing fine until it died of other causes. So trajectory is another thing you need to determine in a gunshot wound case. And as the previous speaker said, the entry wound of a gunshot is usually small and round and very circumscribed, whereas the exit wound tends to be bigger and more irregular and more broad. So remember that kinetic energy. As the bullet passes through, that energy is expanding the tissues around it, and that translates into the exit wound as well. So as it enters, it can be very well circumscribed, but does not necessarily indicate the caliber of the bullet that entered, because skin is distensible. You can't say definitively that the hole that's in the skin matches exactly the diameter of the bullet that went into it. Not even for bone. For bone, you can't. The bullet, of course, is not going to be larger than the hole through the bone, but the bullet could certainly be smaller than the hole in the bone. So in this case, it's well circumscribed. Sometimes in mammals, the hair around the entry wound can be cut or shortened by the bullet. But then the exit wound, the hair is just pushed away and it's not cut. In birds, when the bullet passes through the plumage, feathers are often carried into the wound tract. So that is a good clue as to which side of the wound tract the bullet entered on. In this eagle, the skin is reflected off of the leg, and this bunch of feathers is projecting into the underlying wound tract. And again, in this grackle, the skin is reflected off the breast muscle, and feathers are protruding into the wound tract on the right side of the body. Now, because bullets do fragment when they hit tissues, you can also use that as an indication of the direction of bullet travel. The bullets will fragment on impact with soft tissues a little bit, but when they impact bone, there's a much larger fragmentation because they're hitting a much harder substance, of course. And so in this case, here we see bullet fragmentation before and dorsal to the spine that got impacted by this bullet. So you wouldn't expect the bullet to fragment quite so much from soft tissues up here. The bullet, when it hit soft tissues, had a little bit of fragmentation, but once it hit the bone, it fragmented a lot. So in this case, we determined the direction of travel was ventral to dorsal. Similarly, in this case, there's very little, if any, ballistic elements out here lateral to the right wing, but it's all in here. So in this case, the direction of travel was from the right into the body. So you want to try to demonstrate trajectory through your photographs. so that, because once you do a necropsy, you can't redo a necropsy. If you think you know the trajectory of the bullet travel from your external examination, what I usually do is I take two probes and I place them at the points where I think the entry and exit wound are. I don't go all the way through because I don't want to create a wound that's not there, but I'll put them at the edges and show the trajectory that way and take my picture. Once I have the body open and I can see definitely which way the bullet went through, then I can stick a probe all the way through that wound tract and take another picture. So this can demonstrate to you later on or to a jury where that bullet went. In your record keeping, you can also use standard schematics to point out where those entry and exit wounds were, and you can add this into your report that you'll give to your law enforcement agent or to the jury. Occasionally, though, bullets will do kind of whatever they want. They can fragment and they can go different places. Some particles can get into the bloodstream, and if the animal lives for even a short period of time, those fragments can be transmitted via the bloodstream elsewhere in the body. Moving the animal can make the bullet fragments go places that you don't expect them to go. So you have to take into account all of the pieces of evidence, radiographs, scene, your gross description, everything to determine where that bullet went. And then lead poisoning generally does not happen from these retained bullets. These are a couple cases of a bird that got shot with a shotgun. This is the back of the eye. There's a pellet embedded there. And there's a pellet embedded in the fat at the apex of the heart. And these were not, the lead in this bird was low. The lead concentration in the liver was just at background levels. And we've done studies looking at the lead concentration in the livers of birds and mammals that have had embedded lead particles, and it's been unremarkable and not associated with any kind of toxicity. The lead leaches out when the embedded particles are near a joint space, or if they are in the vasculature, i.e. in some kind of acidic environment. But if they're just embedded in soft tissues, they cause no problem to the body whatsoever. And these small lead particles, small ballistic particles, are surprisingly difficult to find. So we'll often take serial x-rays trying to retrieve these particles for analysis. So for example, these particles in the nose, we just could not get them and see them with our fingers or our eyes. So we took serial radiographs to separate the soft tissues that we thought had the particles in them, and then make sure we retrieved that particle so that we could have a ballistic analyst take a look at them. But also, just like you don't want to hang your hat or put too much importance on your scene findings, you also don't want to put too much importance on your radiographic findings. This is a mountain lion that we got in dead that definitely has a piece of a bullet in its skull. So it also has a very remarkable hole in its face, just rostral to its eye. So I skinned this out, and this hole is not surrounded by hemorrhage. It doesn't look like a lot of active inflammation. There's a lot of fibrosis over the face surrounding it. And so I sent this skull into our dermestid beetle colony, which takes the flesh off of bones very well, and found that the bone around this remarkable hole is proliferative. It looks like it's healing. So the radiographic findings, this mountain lion definitely was shot, but the healing bone indicates that it was shot weeks, years, months earlier, and that hole, that injury, was being dealt with by the body by the time it died, and the cause of death was actually hit by car. It had a skull fracture. So just because you see a bullet doesn't mean that that was the cause of death. You have to take into account every bit of consideration before you can build the story around the animal's death. If you do find bullet particles, you can retrieve them with your fingers or with some plastic elements. Because those striations from the rifling are very important to preserve, you want to avoid the use of metal forceps, which can scratch those rifling patterns up, obscure them, or impart different striations on them that are unhelpful to a ballistic analyst. So when you see them, try to pull out those elements with your fingers and as gently as possible. Wash them off gently with water and alcohol, and then put them in a paper envelope or wrap them in gauze pads so that they can breathe and dry out to avoid corrosion and to preserve whatever elements might be there to examine. Try to get the bullet tips, and then also document whatever else may be around that wound, like abrasion rings or stippling. So to sum up the bone trauma, bones are made to compress, not for distraction. They will, if pulled apart, they'll fail. Think about your physics and your maths. Those matter in bone trauma. And then consider all of the evidence, the scene, plus the radiographs, plus your gross findings, and put it all together to make the story surrounding the animal's death. And gunshot injury is also all about physics. The loss of energy from that speed goes into the body. And you have to take all things into consideration and document everything, but make sure you include everything in your opinion. Don't just focus on one particular part of the story. Take all the evidence into consideration. Okay, now I'll transfer into some poison cases. In the United States, the application and regulation of toxins is done by the Environmental Protection Agency. And the way those toxins, those pesticides are applied is governed by the Federal Insecticide, Fungicide, and Rodenticide Act, or FIFRA. And this FIFRA dictates what toxins can be used, how they can be applied to affect the species that are directed at, and who can apply them. And of course, this differs by country. Here at the lab, this is a graphic showing all of the toxin cases that we've had over the almost 30 years we've been here. The big ones are carbamates and organophosphates. These are insecticides that are used mostly in the agricultural industry. But lead from spent bullets and hunter-killed carcasses is also a big killer of some groups of birds. Depending on how quick a toxin has its effect on an animal, also feeds into how many animals are affected. So the quicker the acting toxin, the more birds or the more animals are going to be affected in a given case. So some cases of organophosphates and carbamates, a single case may have 5, 10 animals in it. Whereas the slower acting toxins like lead and barbiturates, they have one case and generally one animal associated because the animals have time to disperse, they have time to separate, and they don't die in groups. So the rapidly acting toxins, the ones that have their effect within minutes or maybe hours, the animal doesn't have time to have much of a clinical effect, so the tissues will generally not look remarkable. The animal is usually in good nutritional condition. They usually have a full crop or stomach, unless they've regurgitated or vomited that toxic material back up. And they'll often be right there where the toxic particle was. A slower acting toxin has a longer time to take effect, so it makes sense that the animals will be feeling bad over a longer period of time. their fat and muscle will be reduced. Often they're super skinny. They haven't been feeling good, so they're not eating. Their stomachs will be empty, and they've dispersed out into the environment. So there's no real toxin screen. The tests to look for organophosphates are different from that to look for strychnine, or different from that to look for lead. So you have to have kind of an idea of the toxin that you want to find in order to ask the toxicologist for the appropriate test. And sometimes you have to ask them for different tests to get to the answer. So the clinical signs and the gross signs of these things often overlap. There's no one definitive way to check for toxins. And some of the toxins can degrade over time or even in the body. So like zinc phosphate, if you don't take that stomach without opening it, just the whole stomach, and send it for analysis, the toxin will not show up on the toxicologist screen. These are some of the more common organophosphates and carbamates we've seen. We see carbofuran most often, but we have also seen phorate and famfur, and these are the more rapid acting toxins. These often are used as baits. Oftentimes farmers or ranchers are trying to get rid of coyotes, so they will bait a calf or a lamb that has died. But if they bait this carcass out in the world, any kind of vulture or eagle or scavenger will come by and try to take advantage of that bait. So we do see a lot of eagles that die of carbamate and organophosphate toxicity, as well as vultures and other flesh scavenging birds like ravens and grackles. The OP carbs are very toxic to birds. They inactivate acetylcholinesterase so that acetylcholine remains active and causing stimulation at the neural junctions. So there's often seizures that happen and muscle contraction. The organophosphate effects are more prolonged compared to carbamates, but they still have pretty much the same rapid acting course. At the crime scene, you'll often see the bait that was put there and one or several animals in close proximity to that bait. Because it's an insecticide, you'll often see dead flies, dead adult flies. And because it's a neuromuscular stimulant, there's a body position that some birds will assume that is highly indicative of OP carb toxicosis. This is a picture of temic in a baited carcass. This is a lot of temic. I don't usually see this much. There may be just a few grains left over, but this is something to look for. Some of the insecticides will be a liquid and you won't see anything, and some will be more of a bluish or greenish color. And again, they can affect a lot of birds at one time. In this case, there was a multitude of species that were affected. Over here on the left is a coyote, probably the target species for this baited organophosphate case, but also because there's a free meal being laid out, this golden eagle was also a victim of the organophosphate bait. And this is a mammal that was baited, and there are a bunch of adult dead flies. Usually when you collect a carcass in the field, the flies all fly away, but these were already dead, and so they were submitted with the carcass because of this insecticide. So that was a clue that we were dealing with an organophosphate or a carbamate. This is that classic posture of the OP carb bird. There is generally the head and the tail are arched over the back. The feet are brought forward and the talons are clenched, and the wings are sort of flexed to the side. And this just indicates seizure activity and muscular stimulation prior to death. It's not uncommon to have birds sent in that have their talons clutched around straw or grass. So again, Significant postmortem findings include the classic posture. Usually they have a full crop because it's a fast-acting toxin, but they might have horked that up, and they're often in good nutritional condition. You can diagnose this in a live animal by measuring the cholinesterase activity in whole blood. We don't usually do whole blood because we get things that are dead already, but we will often submit half the brain to determine cholinesterase activity to give us an idea if that was what was going on. We take a hemisphere of the brain and submit that, but prolonged freeze time and prolonged time since death can alter the levels of cholinesterase, so you kind of have to take that with a grain of salt. But what we normally do, our standard operating procedure is analyzing the stomach contents for the presence of the toxin, and that usually gives us a good result. It's qualitative. It's either there or it's not. If you want to do quantitative, get a number for the level. We're not really sure what that means because the toxin can be asymmetrically distributed in the stomach contents. Some stomach contents might have it and some might not. So knowing the level doesn't really help you. But it's so toxic to birds that if it's just there, you can usually use that as a diagnosis. Strychnine is another fast-acting toxin. It's usually used against coyotes and rodents. But again, if it's misapplied or if the rodent ingests it and comes out of its burrow and then is eaten by an eagle, it can be passed on to a secondary species. It's usually formulated as a red or a green grain that is put into a burrow. And it often will affect non-raptor species like ravens and crows and grackles. This too has an effect on the nervous system. Much like OP carbs, it can cause seizures and respiratory impairment. And the stomach contents, the crop contents, and the ventriculus contents are the best contents to measure. You can try to do the liver if they don't have any stomach contents left, but those measurements are not quite as reliable. Generally, in the faster acting toxins, the stomach contents, the immediate impact is the best test sample, whereas the liver, while it has gotten a little bit of toxin to go through it and has metabolized it a little bit, might be less of a good sample. So the labeling of the toxin will tell you how that is supposed to be applied. It's supposed to be applied deep in the burrows. But if the rodents push it out of the burrows or if the rodents ingest it and come back out, then that leaves the scavengers and the predators open to strychnine secondary toxicosis. This is an example of some of the seeds that are often laced with strychnine. And these are the seeds that are found in a Canada goose. And they do have this kind of green/blue tinge to them. Barbiturates, of course, are most often used in euthanasia of domestic animals. Each state in the U.S. dictates how those euthanized domestic animals can then be disposed of. So usually it's either incineration or deep burial. But sometimes these euthanized animals are just discarded in the trash, which then makes them available to scavengers and predators that might want to prey on and scavenge the dead flesh. About 81% of the animals that we have diagnosed with barbiturate toxicosis are eagles, mostly bald eagles. Because eagles' feeding habits are very similar to vultures. I mean, basically, they're just very pretty vultures. Generally, when an animal is euthanized, the barbiturate diffuses into the muscles. So any tissue made available has barbiturate in it. and it will not break down in the system like strychnine can. And once it's ingested, once those tissues with the barbiturates are ingested, they can they can intoxify the eater. The stomach contents, again, are the best sample to use, but liver may also be used. Generally, you get a lot of birds right there at the scene, but the effect can be prolonged, and it can allow birds to fly away from the scene and be found much later. It's not unusual for us to have a case of 3 or 5 birds right there at a dump site, but then a day later find another bird on a road 20 miles away that had the same cause of death. To link those, you can take the stomach contents and do genetic ID on them to determine if they ate the same species. And if the geneticist has the appropriate database, you can even link to see if it was the same individual animal that those birds ate. Sometimes these birds can have evidence of blunt trauma if they fly away and fly up into a tree, and then the effect takes over them and they fall out of the tree. So they can have just bruising, usually not fractures, but bruising. And you can, in live animals, submit blood for analysis for toxicology on these. Moving into some of the slower acting toxins, anticoagulants are used to control rodents in the US. We don't have the first generation anticoagulants anymore, but we do have brodifacoum, which is the most popular second generation anticoagulant out there for use. The vast majority of eagles or owls that we see through the lab have some level of anticoagulant. The anticoagulants, once a rodent eats them, is quickly metabolized, and that metabolite is no longer toxic. So what has to happen for secondary toxicity is for the owl or the raptor or the eagle to eat the rodent very soon after it has ingested the anticoagulant, so that the anticoagulant is still present in its stomach. And in that way, secondary toxicity can occur. So of course, anticoagulants interfere with the clotting cascade by decreasing vitamin K. It's a long-acting type of toxin, so the birds generally tend to be thin. They're often pale. Often their stomachs are empty. If you find a rodent, they might have that blue or green material in the stomach, but you don't generally find that. And liver, because it's a slower acting toxin, is the best sample to take to determine if an animal has been exposed to anticoagulants. So in this case, this was an eagle. This is the sternum, the breastplate, and the pectoral muscles are reflected off to the side. In this case, there's excessive bleeding. You wouldn't expect to be such excessive bleeding deep in the pectoral musculature. The anticoagulants can cause more bleeding than you expect based on the trauma that might be incurred. So again, this is skin reflected back from the leg of an eagle, and there's just way more frank blood than you'd expect from being bumped. Sometimes, though, all you see is tissue pallor. The muscles and the internal organs of this eagle are just very pale. And you might see digested blood throughout the GI tract. And this is from just microhemorrhages into the lumen of the stomach and the intestines, and just the constant loss of blood through capillaries into the lumen of the GI tract causes anemia and causes this soft tissue pallor. So diagnosis in this case is made on levels of lead or levels of anticoagulants in the system in combination with your gross findings. Because a lot of the owls and eagles and raptors and things that eat rodents will have some background level of anticoagulants, you want to take into account what else you see during necropsy. Just because they have a higher level of anticoagulants does not mean that that was the cause of death. So moving on to lead is also another source of toxicity for birds. And this is, again, another chronic acting, a long acting toxin for the most part. It kills up to 3 million birds a year within the US. And a lot of that is scavengers from eating hunter-killed carcasses. When a hunter kills an animal, they may take the insides out of the animal and leave those insides, which might have lead bullet fragments, out in the field. When that material is ingested by whatever scavenger comes by, it can cause an effect on the system. So the sources are shot pellets and lead bullet fragments. Less often, rarely, I see fishing sinkers or mining waste as causes of lead toxicity. So at the lab, most of the lead toxicities we've seen are in eagles, largely bald eagles, because, like I said before, they have basic vulture scavenging behavior. But it is also a major cause of death in the California condor, which is a critically endangered large raptor in the United States. About half of the condors that we see die of lead toxicity. It's difficult to prosecute because there is such a long time course between ingestion of the lead and clinical effect and death. Some bird species appear to be a little more susceptible, like the condor tends to be a little more acutely susceptible and die quicker due to lead toxicity than eagles do. So you have to take into consideration the clinical findings, the gross findings, and what you're seeing on x-rays. There may or may not be any kind of metal still in the GI tract. It may have passed through already, but there are often some evidence in the gallbladder and in the GI tract that you can use to build the story. When lead is ingested, it hits the acidic environment of the stomach, and the isotopes come off of the lead and then enter into the bloodstream. In the bloodstream, it's eliminated pretty quickly through the liver and the kidneys, less so. But then some of that lead can make it into the cells of the liver and then eventually into the bone. And it's these three compartments that can be tested to determine how rapidly that lead had an effect and how long that bird has been exposed to lead. Storage in the bone is kind of considered to be like lifetime accumulation of lead exposure. But during times of egg laying, when they're mobilizing calcium from the bone and putting it into the eggshells, that lead can also come out into the bloodstream, into the liver, and cause a retoxicity. Most often lead toxicosis is more chronic, so you see that muscle and fat wasting, you see the inanition, but sometimes it can be acute with a high intake of a lot of lead. You can get an acute toxicity and an early death. The findings generally are a thin bird. The bile in the gallbladder tends to be really thick, super sludgy. It might not even flow out of the gallbladder once it's cut. It might just sit there. The crop of birds tends to stop moving, so there's often rotted liquid food in the crop. And then there's often bile staining within the GI tract and on the feathers around the vent. But then sometimes you can't tell until you test the liver. So this is a picture of bile staining within the ventriculus and proventriculus. And here you can even see the lead particles that were inducing lead toxicity in this bird. The liver is the best sample to take for lead toxicity testing in a dead animal, but blood is of course better in a live one. And bone and feather can give you an idea of what the lead levels have been over time, over a longer period of time. If a feather is growing during a lead exposure, you'll see that in the barbs as distinct bands, and you can kind of do a timestamp of how often and when this bird had been exposed to lead. So it will, if it gets into a joint space, like if it's embedded, like I said before, if it's in a joint space, that acidic environment can leach the lead out and cause issues. But for the most part, those embedded pellets don't cause any kind of issue. So with regards to toxins, I know I went over a few of them, but keep an open mind. People think of weird things to do to try to get rid of wildlife that they don't want on their property. You look on the web for innovative ways to get rid of wildlife, and you can find everything from scattering parvo feces around to using xylitol on bait carcasses or throwing dark chocolate out to poison things. So if something does not fit and the test results do not come back as what you expect, think outside the box. Think of something else that could be going on. And then think of other things to test. The USGS, the United States Geologic Survey, put out this paper. They tested on really decomposed birds. They took the feet and tested them for organophosphates and carbamates, and they found that they found the compounds there. In highly decomposed birds, when they feed, they stand on the carcass. So there's some absorption and some contact with that bait. And in a bird that has been scavenged or nothing left to sample, the feet can actually give you a good idea. When we've gotten animals that have been decomposed and scavenged, we've tested the tongue, we've tested skin, and surprisingly, we sometimes get some good results. So with that, I want to thank you very much for your attention. If you want more information on wildlife forensics or veterinary forensics, I suggest looking up the International Veterinary Forensic Sciences Association, which is it's an international association that has veterinarians, law enforcement agents, lawyers that are all interested in veterinary forensics. And there's also a journal that is focused on veterinary forensics. So thank you very much. I appreciate your attention.